I think that, first of all, we need to acknowledge what we have done, because we have done a lot for our diabetic individuals. If you look at the change in the mortality, cardiovascular mortality over the years, there has been a progressive decline in the mortality among the type 2 diabetic population. However, if you do compare the mortality versus patients with subjects without diabetes, the diabetic individuals still have at least twice as much risk for cardiovascular events and cardiovascular mortality. That means that cardiovascular mortality still remains the major reason, the number one reason for mortality among the diabetic population. And this also called for further and better management and treatment to try to reduce the cardiovascular risk in these individuals. And I think also, while we try to do our best to try to reduce the cardiovascular risk, the presence of a cardiovascular complication may also make our life less easier to control glucose in these individuals. Because in these individuals, we want to avoid some problems, like, for instance, hypoglycemia. So cardiovascular disease in diabetes still represents a major problem. But I think that you share the same feeling, isn't it?
Yes, absolutely. I mean, all the patients that I see who have cardiovascular disease in diabetes, it's not only making it more difficult to treat their diabetes, it really affects their lives in a very significant way, because they may develop symptoms, for example, of chest pain or symptoms related to heart failure like breathlessness, and this has a very, very significant effect, adverse effect on their quality of life.